Biodistribution of radiopharmaceuticals. Biodistribution of radiopharmaceuticals is the properties of a radioactive element that determine tissue localization and excretion. Determinants of localization of radioactive drugs. Determinants of renal excretion. The properties of a radioactive element that determine tissue localization and excretion. Chief determinants of biological localization is oxidation state of the physiological pH, solubility of the stable state, tendency toward incorporation into organic compounds, tendency to be chelated or to form protein complexes in circulation or in particular tissue. Oxidation state, ionic size and charge. Group I, the alkali metals, Na11, K19, Rb37, Cs55, Cu29, Ag47, and Au79. The alkali metals, the element Rb, the principal location is in the muscle, and the principal excretion is through the urine. Element Cs, the principal location is in the muscle, principal excretion is urine. Then there's the subgroups. Cu, the principal location is in the liver, and the principal excretion is in the urine. Ag, the principal location is in the protein, and the principal excretion is feces. Subgroup 1 again is Au, and the liver is the principal location. The principal excretion is the urine. Group 2, which is alkaline earths, is 4Be, 12Mg, 20Ca, 38Sr, 56Ba, 88Ra, 30Zn, 48Cd, 80Hg. All of these elements, the principal location is in the bone, and then the principal excretion is through the urine and feces. Subgroup 2, ZnCdHg, the principal location is in the liver and the kidney, and then the excretion is in the feces. Gallium, the principal location is in the bone and the muscles, and the principal excretion is feces. Indium, the principal location is in the bone and liver, and the principal excretion is in the feces. Thallium, the principal location is in the muscles, and the principal excretion is in the feces. Samarium, the principal location is in the liver, bone, and the principal excretion is in the feces and urine. Gd, the bone, the principal location is in the bone and the liver, and the principal excretion is in the urine. Sn, the principal location is in the bone, and the principal excretion is in the urine. Pb, and the principal location is in the bone, and the principal excretion is in the urine and feces. P, the principal location is in the muscle and the bone, and the principal excretion is in the urine. Cr, the principal location is in the bone and the blood, and the principal excretion is in the urine. Moly, the principal location is in the liver, and the principal excretion is in the urine. F, the principal location is in the bone, the principal excretion is in the urine. I, the principal location is in the thyroid, and the principal excretion is in the urine. Technetium, the principal location is in the GI tract, and the principal excretion is in the urine. Fe, the principal location is in the blood and liver, and the principal excretion is in the feces. Cobalt, the principal location is in the liver, and the principal excretion is in the urine. Properties of radioactive element that determine the tissue's localization and excretion. determinants of localization of radioactive drugs, and determinants of the renal excretion. Determinants of localization of radioactive drugs: A, organ characteristics, B, drug characteristics. So for the organ characteristics, it's relative blood flow to the organ, types of capillaries in the organ, the capillary density or number per unit, the number of tissue, the volume of tissue, specific drug receptor sites. B, the drug characteristics, the molecular size and shape, the degree and strength of the binding to the plasma proteins, lipid solubility, specific drug receptor and transport mechanisms. The chemical structures influencing lipid solubility. Mechanisms of localization. There's active transports, phagocytosis, cell sequestration, capillary blockade, simple or exchange diffusion, compartmental localization, metabolic substitution. The mechanisms of localization. There's active transport, which is thyroid scanning with iodide or protectinate, renal scanning with iodohypurate, liver scanning with HITA, pancreatic scanning with selenomethionine. Thyroid scanning with the iodine or protectinate. 43-year-old female, exophthalmos, agitated, elevated free T4, undetectable TSH, technetium-99 protectinate scan. The RAIU is 66%, and the treatment is 7.3 Ni iodine 131. Active transport, liver scanning with HITA. It's a normal Dissida anterior view at 60 minutes. Phagocytosis is the liver scanning with colloids, spleen scanning with colloids or heat-damaged red blood cells, the bone marrow scanning with microcolloids. Cell sequestration, the spleen counting with the heat or disease-damaged red blood cells, chromium-51 or technetium-99m. Capillary blockade is lung scanning with the technetium-99m labeled human serum albumin, or MAA. Spleen scanning with colloids or heat-damaged red blood cells. The simple or exchange diffusion, bone scanning with fluorine 18 or technetium-99m phosphonates, brain scanning with technetium-99m protectinate or DTPA, the bone agent structures. Types of bone scans: whole body, limited, 3-phase. Brain scanning with technetium-99m protectinate or DTPA, normal imaging. Brain death. Compartmental localization, blood pool scanning of heart and vascular system with technetium-99m red blood cell or HSA. Cerebrospinal fluid space with indium-111 DTPA. The CSF leak posterior nasal pharynx. Mechanisms of localization, the metabolic substitution of fluorodeoxyglucose, which is FDG, imaging for cancer, brain, and heart. The molecular formula, the molecular weight, the half-life is 110 minutes. D-glucose C6H12, oxygen 6. MW is 180.16 Dow. Whatever. The F18 FDG imaging for cancer and lymphoma. Ischemia or infarct lateral wall. Reversible ischemia lateral wall. That's using the F18 FDG imaging for the heart, and the imaging for the brain for lymphoma. The biodistribution of radiopharmaceuticals, property of radioactive element that determine tissue localization and excretion, determinants of localization of radioactive drugs, determinants of renal excretion. Determinants of renal excretion. A is active renal tubular transport. Many organic acids and some organic bases are actively excreted by the renal tubules. Molecular size, or B, molecular size, unbound substances with a molecular weight is less than 40,000 and are eliminated by the glomerular filtration. C, plasma protein binding. Substances tightly bound to plasma proteins are not filtered by the glomeruli. D, lipid solubility. Lipid-soluble drugs tend to be reabsorbed by the renal tubules and are not excreted.